So let's move into the area of desire then, libido, and where we are today with that. We certainly think of the most influential component as a hormonal component, but we know there are a lot of neurotransmitters that are involved there as well. And yeah, so that's sort of the normal teaching, right? That's why I want you to talk about that. We do see this libido seems to decrease as women age, but is it multifactorial? And we're all just throwing it in that hormonal bucket and blaming it on just a lack of hormones of menopause. So what are your thoughts on that?
Desire is an amazing topic. It is not easy. It's not simple. It's different for everybody, and we got to start with the basics. So if you break down two different types of desire, we've got responsive and we've got spontaneous. Spontaneous is your new relationship energy. You are like, it's like your brain is on crack. It doesn't care about work. It doesn't care about food. It doesn't care about anything else. You got this new person in your life that is hot and heavy. That is spontaneous desire. That goes away. The brain normalizes. The brain adapts. It gets used to stuff. That new relationship desire goes away around 12 months. So in our society, we have put on a hierarchy that monogamous relationships, long-term monogamous relationships, are something that we participate in. That's fascinating. But we can't say, I'm in this 10-year relationship, I wish I had spontaneous desire. It's not how brains work, right? So it's really understanding the brain. And also, that's what we're sold. That's what Hollywood is. That's what music is. It's really telling us that spontaneous desire is the default. One might argue it might be the male default. Testosterone's of 800 will do that to people, but it's really not everybody's lived experience. And it's quite normal to have responsive desire. What responsive desire is I'm busy, I'm at work, I'm thinking about other things, I'm not thinking about sex. But when I'm put in a sexual context, my partner and I are starting to get together, I'm starting to think about it, I'm starting to feel it, now I want sex, I'm happy having it, it's a great time. So when a woman comes in and she says, I have low desire, I always say, why is that a problem, right? And the question is, do you like sex? If she doesn't like sex, she doesn't have the orgasms. She's doing it for somebody else. She's doing it to keep somebody else happy, whatever it might be. You can't desire that. You do not have a low desire problem. You have a sex is an awesome problem. My analogy is I love Haagen-Dazs mint chip ice cream. Like I will eat it. I have spontaneous desire for Haagen-Dazs mint chip ice cream. You give me melted ice cream, I don't want it. So that is like, if the sex isn't good, of course you're not going to desire it. That's dopamine. You have to have something worth desiring in order to create the desire. And then as far as the responsive desire, if you love having sex and it's great and you always forget how good it is, it's just lovely, you just get busy, that's not a problem either. Prioritize sex. Again, we don't get taught scheduling sex. I don't spontaneously want to work out, but I'm a very fit person because I love it when I do it and I want it in my life. I don't have spontaneous desire for working out. Same with vegetables. So it's like, if you think about sex as a just not unique thing, it's just another thing in our life of like, if you want to prioritize it, prioritize it. Amazing sex life doesn't help in ourselves.
You're making me laugh.
Good.
Sex, lima beans.
Exactly.
She brings vegetables into the conversation.
It's normalizing an otherwise awkward conversation, right? That's what you have to do for patients. Otherwise, they can't listen if you can't make them laugh. And you can't normalize it like, yeah, I want to exercise, but like, unless I prioritize it, it's not going to happen. But I love it when I do it. I love it in my life. There's an amazing book called Magnificent Sex by Peggy Kleinplatz. And she looked at all these people. She basically said, who's having amazing sex, right? These people raised their hand. She researched them. Not one of them said they had an amazing sex life because of spontaneous desire. That is not an ingredient in a wonderful sex life. It's prioritizing, it's communicating, all of the good things that creates for an excellent sex life. So that's why desire is so fun and interesting, because nobody knows anything about it. They all think that it should be like Hollywood, Tom Cruise and Cameron Diaz or whatever. That's not how it is. And you can have an amazing sex life without having spontaneous desire. When you get into perimenopause and hormones that you asked about, that was the myth. That's why I got into hormones, because people are like, yeah, but you know what happens to sex after menopause? And I'm like, what's the data show? So I did the same thing that I did for female sexual health. I'm like, let's go look at the menopause data and sex lives. The two top reasons that women stop having sex after menopause: number one, availability of partner. Number two, vasomotor symptoms of menopause: hot flashes, night sweats, poor sleep, worse mood. Well, I can't help you with the first problem, but now I can help you with the second one. right? You get a woman feeling better, her desire can naturally come back up.